Singapore develops new therapy for metastatic intra-abdominal cancer. The National Cancer Centre Singapore has discovered a novel therapy approach for peritoneal carcinomatosis, a metastatic type of intra-abdominal cancer with limited treatment choices and low overall survival rates. By addressing what feeds cancer cells, the results were published in Cell Reports Medicine on February 15, 2022. Cancer spreads to organ surfaces, soil, by intricate interactions in the body, according to a generally accepted scientific notion. Most cancer therapies target the seed directly, such as chemotherapy, which prevents cancer cell growth. Immunotherapy has grown in popularity as a cancer treatment method during the past 9 years. It works by modifying the soil of the tumor by recruiting the body's immune system to attack cancer cells. The NCCS Laboratory of Applied Human Genetics has discovered a way to target water to produce an arid environment unfriendly to tumor cell development. This study found that ascites, or excess fluid, water, in the abdomen of individuals with metastatic intra-abdominal malignancies, may be directly targeted to eliminate the fuel that promotes cancer development. The researchers discovered that PI1, plasminogen activator inhibitor 1, is an excellent predictor of responsiveness to direct inhibition and may slow cancer cell growth. PI1 was previously unrelated to the development of intra-abdominal malignancies. Using blood samples from 150 patients with intra-abdominal cancer, Professor Ong and his colleagues found 3 biomarkers that potentially predict patient outcomes and response to PI1 treatment. A new NCCS translational research therapy program is based on our findings, which not only reveals a unique treatment technique for peritoneal carcinomatosis. Also, addressing water instead of seed and soil may lead to a paradigm change in cancer treatment. The study's principal investigator, Professor Ong, treats patients with peritoneal carcinomatosis at Singapore General Hospital and National Cancer Centre Singapore. The research team is now collaborating with several government organizations and pharmaceutical companies to target water in cancer patients' bodies.